Hello everyone. So today our group will be presenting about upper limb flexibility. Our group members consist of me, Aisyah, and my other two classmates, Mohd Akhmar and Nurul Amiratunnajiah. Throughout the presentation, we will explain about these components, which consist of the introduction of our CSR program, Ceop 5.0, and then followed by the flexibility component, which is back scratch test, participants' data, interpretation, findings, and discussion from the participants' data that we have collected, and then patient management, the reflection of the program, the project evaluation, future suggestion, and lastly, conclusion, reference, and evidence. So for the introduction, we as physiotherapy students from UiTM Alam have been conducted the CSR program COP 5.0, which stands for Community Engagement with Older People on 18 May and 15 June 2024. This program serves as an educational initiative to share knowledge with the community, which focuses on educating the community about health status, promoting a lifelong healthy lifestyle, and raising awareness about injury risks and health issues. We aim to connect what we learn in the theory with real-life practice while also fulfilling the requirements of our physiotherapy in the gerontology assignment PhD 554. Our objective with COP are aimed at creating a positive impact in our community. Firstly, we strive to provide early exposure and share valuable knowledge with all the adults, encouraging healthier lifestyles and ultimately enhancing their quality of life. Secondly, we are committed to training physiotherapy students like us to actively participate in community activities. By doing so, we are not only contribute our skills and services but also learn firsthand about the needs of our community members. And thirdly, COP is designed to equip us with a broad range of knowledge and skills in physiotherapy. This ensures that we are all well prepared to address diverse healthcare challenges effectively. And lastly, we are dedicated to fostering and maintaining strong collaborations between us as future physiotherapists and the elderly community. Through ongoing engagement and support, we aim to build lasting relationships that benefits both parties. Now, we move to one of the assessment components that we have covered during the program, which is flexibility. According to Dantas et al. 2011, flexibility can be defined as a physical feature responsible for the voluntary execution of maximum joint range of motion by a single or multiple joints with morphological limits without a risk of injury. The flexibility assessment consists of two types, which are upper limb back scratch test and lower limb sit and reach test. Upper limb flexibility is crucial for overall health and well-being. This is because enhancing the range of motion in the upper limbs promote joint mobility and muscle elasticity. This not only helps in daily tasks but also improve overall physical functionality. Next, flexible upper limbs play a significant role in reducing the risk of injury. By improving motor performance during daily activities, leisure activities and sports, we can prevent strains and sprains, keeping ourselves safe and active. Another vital benefit is the alleviation of aches and pains. Improved tissue tolerance to stretching can reduce discomfort in the joint and spine, making movement more comfortable and less painful. And lastly, enhancing upper limb flexibility contributes to better balance and posture. For example, spine flexibility influences abdominal muscle performance, which is crucial for movement like trunk curl-ups from a supine position. This shows how upper limb flexibility supports overall body stability and posture. Next, I will explain in detail about the back stretch test. The purpose of this test is to measure flexibility in the shoulder joint and shoulder arc on both right and left side. To measure this, we look at the gap between the tips of the middle fingers on both hands. This gap is measured by a ruler to the nearest centimeter or half inch. The results are recorded as follows: a negative score if the fingers do not meet, and a positive score if the fingers overlap. To perform the back scratch test, first, have the patient stand up straight and then place one arm and hand on the lower back and move it up to the spine toward the head. Simultaneously, place the opposite arm and hand behind the neck, moving it down the spine. The goal is to place the long fingers of each hand as close to each other as possible or to overlap them as much as possible. Finally, repeat the procedure with the opposite arm and hand. Now, let's take a look at the normative data for the back scratch test, which help us interpret the result based on the age and gender. As we can see, the results are divided into three categories: below average, average, and above average. These categories are further segmented by age groups for both men and women, and this data helps us to assess shoulder flexibility accurately for different age groups. It allows us to identify areas where individuals might need improvement or where they are excellent. By understanding these normative values, we can better tailor our physiotherapy intervention to meet the needs of each individual.
Alright, next, participants' data, interpretation, findings, and discussions. So firstly, the participants consist of 12 elderly with age range 60 to 78 years old with 5 male and 7 female. And this is the raw data acquired. This is the vital interpretation. We find all minimum value, maximum value, and mean for each vital signs for male and female. Systolic, diastolic, SpO2, and glucose level. And we have concluded in one overall interpretation using mean overall. So by looking to the mean overall for each vital sign alone, we can say systolic has 148 mean overall, shows hypertension stage 1. For diastolic, the overall mean is 75.8, which is an optimal value. For SpO2, we have 97.4%, which indicates normal values also. And lastly, for blood glucose level, the overall mean is 7.38, which is in diabetics range. Now, this is our focus, backscratch data interpretations. So basically, we have interpret by two point of angle. First, we interpret right side to left side direction, and second, best side to poorer side. Okay, so basically, you can see in the slide. Overall, most participants got average score, and few minority got below average score, and no participants got above average score. So from the interpretations, we have concluded to 6 findings. So the first findings is 75% of participants, or 9 from 12 participants, had elevated systolic and or diastolic blood pressure, which classified as stage 1 or stage 2 hypertension. The second findings is all participants had SpO2 levels within the normal range, which is 95% to 100%. And the third finding, 58% or 7 out of 12 participants had fasting glucose level indicating diabetes. 35% had levels consistent with pre-diabetes, and 17% had normal fasting glucose levels. Next, let us look to the discussions of each finding. So for finding 1, the finding underscores the high prevalence of hypertension among the elderly, which aligns with the previous studies indicating that hypertension becomes more common with age due to arterial stiffness and other physiological changes. The second finding, the finding aligns with the expected norms for healthy elderly individuals. This might be due to active and healthy lifestyles of the participants that make their respiratory function well preserved. For the third finding, the finding highlights significant glucose metabolism disorders in the elderly population study, and this aligns with epidemiological data showing increased prevalence of diabetes and prediabetes with age. Next, let us look to the discussions of each finding. So for finding 1, the finding underscores the high prevalence of hypertension among the elderly, which aligns with the previous studies indicating that hypertension becomes more common with age due to arterial stiffness and other physiological changes. The second finding, the finding aligns with the expected norms for healthy elderly individuals. This might be due to active and healthy lifestyles of the participants that make their respiratory function well preserved. For the third finding, the finding highlights significant glucose metabolism disorders in the elderly population study, and this aligns with epidemiological data showing increased prevalence of diabetes and prediabetes with age.
So to improve our flexibility, we can do stretching exercise. So according to SSF, the FITT is F frequency. We can do 2 to 3 times per week, or every day is better. And then for I intensity, we're going to stretch until we feel the stretch or until we slightly discomfort. For T time, we can hold the position, the stretch position, about 30 seconds. And then the last one, the type of exercise or movement. We can do all types of movement that involve our upper limb, such like this, and all of the movements.
So these are the list of exercise or movement that you can do for our flexibility exercise or stretching exercise. First, the shoulder rolls. Second, overhead reach. Third one, chest stretch. Fourth one, cross body shoulder stretch. And then tricep stretch, seated towel stretch, wrist flexor stretch, and the last one, we can do wrist extensor stretch.
Okay, so next, I'll be reflecting on our program. So by highlighting key areas such as engagement, communication, teamwork, organizing, and also problem solving. So let's dive into the details. So first, let's talk about engagement. So while we engage the elderly fairly well, we need to improve our connections with international students to enhance inclusivity and diversity. Next is about communication. We had pre-program miscommunication between post-matric and post-diploma committee member. However, during the program, communication was good, but addressing these issues beforehand is very crucial. So moving on to the teamwork before the program was suboptimal due to the barriers between the committee members. However, teamwork during the program was excellent. Therefore, strengthening the pre-program teamwork is also essential. And the next one is about organizing. So we faced some challenges with a small venue, time constraint due to holidays and also delayed paperwork. So by rotating good duties among community members, it could also enhance skill development. And lastly, it is the problem solving. Even though we manage last minute changes well, but there is still room for improvement in anticipating and managing issues proactively. Okay, now let's see our project evaluation. So in this project, we aim to produce quality graduates. So while there was some success, not all students work well together or explore new knowledge. This shows a need for better collaboration and also learning opportunities. By fostering relationship with the elderly, it was another goal. Unfortunately, knowledge transfer was inadequate, highlighting a communication and also engagement gap. So our third goal was to enhance knowledge transfer to the community. This was partially met, but effectively sharing knowledge with the elderly remains a challenge. So we aim to train physiotherapy students. While there was some success, the impact on student skill and contributions needs some improvement through better teamwork and also knowledge dissemination. So in summary, not all of our objective outcomes were achieved successfully. So the key challenges include that students not working together effectively or exploring new areas of knowledge. And the second one is knowledge not being properly shared with the elderly. So by addressing these challenges, it requires a focus on enhancing teamwork, improving the communication, strategies, and also ensuring comprehensive knowledge transfer. Alright, now I'll present our recommendation for improving our future project based on our recent experiences. So firstly, let's address the communication. So to improve the teamwork, we need to dissolve barriers between post-matric and also post-diploma students. This will foster better collaboration and also information sharing. So next is about the timing. So we should avoid scheduling the events around important holidays to maintain participant attendance. Additionally, submitting paperwork earlier will increase our chances of securing sponsorships. And finally, about the venue selection, by choosing a larger venue with ample space and good air circulation will enhance the overall experience for participants and also facilitate better interaction. So by addressing these key areas, improving the communication, optimizing the timing, and also selecting appropriate venues, it will significantly enhance the effectiveness and success of our future projects. By breaking down these barriers, planning strategically, and creating a conducive environment, we can ensure more meaningful engagement and also better outcomes for all participants.
This is the evidence that shows communication between the students and the participants, and then the additional role that we have take for our members and the back scratch booth test that we have been arranged. So this picture shows the team COP members and then the venue that we have been used for our program and the layout.
Alright, so we come to the conclusion. So not all the project's outcome were met successfully, and there is also significant room for improvement. This project already highlighted the importance of the upline flexibility among the elderly. Some management strategies and data interpretation were all based on evidence-based practice. So that is the conclusion for our presentation today. So thank you for your attention. Thanks.